Hello, welcome to this week's Partner Spotlight. This week's Partner Spotlight is a really exciting one and a unique one. As many of you know, we are planning for our first ever Kansas City Physical Activity Summit, which is going to be held on Thursday, September 10th at 8:30 a.m. until 12:30 p.m. We've put a lot of work into it. We've got a great interactive program. So even though it's going to be an all virtual event, this is not, it is definitely not sitting in front of a Zoom presentation in your chair for 4 hours. We've got physical activity breaks worked in. We've got multiple breakout sessions built into the schedule. So you'll have lots of time to interact with other people who are attending the Physical Activity Summit. If you haven't signed up yet, there's still time to sign up. You can go to kcphysicalactivityplan.org to sign up, and you can sign up until the morning of the event. In advance of that meeting, I thought it would be a great time to learn more about physical activity plans, and the obvious person to talk to is the current chairman of the U.S. National Physical Activity Plan, Dr. Bill Kohl. Dr. Kohl, thanks for joining us today.
Well, Robin, thanks for having me. It's a really exciting time in Kansas City, and I can't wait to see the fruits of your labors here with the summit.
Yeah, thank you. So tell us just a little bit about yourself. I noticed you've got a great background, a screen background right now.
I'm currently in Austin, and this is an iconic bridge that goes across Lady Bird Johnson Lake in the center of town. It also is an area where lots of physical activity happens. We have lots of trails and walking and running clubs and so forth that use this as kind of the town square in Austin. This particular bridge is very famous for that.
Great. So obviously you're in Austin, so you work at the University of Texas in Austin.
I'm a professor at the University of Texas. I run the physical activity epidemiology training program here, and I've worked in research and promotion for physical activity for virtually my whole career in 35 years or so.
That's great. And so, I mentioned we wanted to talk to you about the National Physical Activity Plan. So you're currently the chairman of the National Physical Activity Plan. I think that's the right title. Can you just tell us about what the National Physical Activity Plan is?
Yeah. The National Physical Activity Plan began with the National Physical Activity Plan Alliance, which is an organization. It came together in the early 2000s, if you will, and brought stakeholders together, expert panels and the like, with the vision that one day all Americans would be physically active. They would live, work, and play in environments that encourage and support physical activity. I'm a researcher by training. We continue to need more research in this area, lots of questions to be answered. But physical inactivity is a public health problem, and we need to urgently address it using strategies such as what you're doing in Kansas City, what we're doing nationally, what several states are doing also, making it a priority. If you don't make a public health problem a priority with a plan of attack, it doesn't get addressed, Robin. So what happened in the development of the plan in 2010, the original plan was released. 2016, it was modified and expanded, building on the plan. It was the same kind of a process, but it got much more specific in terms of how it was organized. There are 9 sectors in the plan: business and industry, community recreation, fitness and parks, education, faith-based settings, healthcare, mass media, public health, sport, and transportation, land use, and community design. And each of these sectors is designed because that's where people live, work, and play and pray, to find ways, tactics, and strategies that can be utilized and can be expanded on to promote physical activity through those sectors. It's an interwoven plan that doesn't just rely on having people go to the gym more often, but it doesn't rely on people just working in their garden or going for a walk in the evening more often. It's meant to be a comprehensive approach to take care of this vision, which is all Americans will be physically active in a healthy way. So in 2016, the plan was modified, brings us to 2020. And one of the big things that's happened in this last year, 2020 hasn't been weird enough. The National Physical Activity Plan Alliance has come together with the Physical Activity Society and with the National Coalition to Promote Physical Activity, three separate organizations. We've merged into the new Physical Activity Alliance. Each of the groups will have their own section, if you will, and continue the work. But we thought that it would be much more effective to have one voice rather than multiple voices and fractured messages. So look for more work. If anyone's interested, the website for the National Physical Activity Plan or for the Physical Activity Alliance is quite easy to find. You can learn more about it there. But that's a little background on the plan and how we got to where we are today.
Yeah, thanks. And you mentioned the sectors, and and how that fits into the plan. And I think that's a really important point, because a lot of people think about plans. They think of maybe like in Kansas City, the bike plan that they're working on, or something like that. So tell me about why all of the different sectors are important for a physical activity plan.
Well, physical activity specifically, and the way you've approached it in Kansas City, I think is right, spot on. Physical activity, again, just doesn't happen in one silo. It's really one behavior that encompasses many different many different areas of our daily lives. Transportation. You can certainly bike for recreation around the many trails that are available in Kansas City and the Midwest, but there's also biking for transportation. And how do you engage the transportation sector? People who may not think about choosing mass transit that always has a component, the last mile, first mile kind of idea that always has a component of active transit involved with it. Oftentimes in faith-based settings, there's huge opportunities since there's cultural relevance. There's opportunities not just in the hour or 2 hours every Sunday that people go to church, but throughout the week where churches, mosques, synagogues all are designed to bring people together, and finding out ways to utilize that support structure to be able to promote physical activity. Business and industry as another example of a sector. We're finding out that it's good business to have healthy, physically active employees. And what can large, small, medium-sized companies do to help promote these factors, these behaviors among their employees? So oftentimes in the past, we've thought of, well, let's go to the gym and be physically active. The sector-based approach points out strategies and tactics that can be used in each of these other sectors, in addition to the gym, in addition to walking in the neighborhood. So it's really trying to get woven into the fiber of how we live.
Great. And so we have this national plan, and if anyone if you haven't read the national plan, I encourage you to Google National Physical Activity Plan and check it out. It's a very thorough document. It's very complete, lots of great and very specific strategies and tactics that people can use. And so since we already have that, where do you think local or regional plans fit in?
Well, tailoring, I think, Robin, the biggest thing is tailoring this approach to local needs and actions, or local cultures also, is incredibly important. One size doesn't fit all. and using the national plan as a framework, and then adapting as you have in Kansas City to what local resources may be available, local partners. And as you roll out your initial 6 sectors, there will be additional ones, but I think choosing where the biggest bang for the buck might be is a great idea. I believe all health is local. I don't believe that policies at the federal level or public health planning at the federal level make any kind of an impact of note in the people in front of us or in our neighbors or in you and I. It's bringing that leadership for example, in the national plan to bear on local situation and modifying it accordingly so that it works for what you're trying to do or what local people are trying to do is where the critical thing is. I think what the National Physical Activity Plan has allowed us to do is have a framework on which to build and guidance on which to build state and local planning. And I think that that's really the next step in this area of physical activity and public health.
Yeah, well, along those same lines. So the National Physical Activity Plan has been around for 10 years now. And, I consider myself to be very in touch with the work that you guys do. But as I was looking through your website, even just this week, I found a whole bunch of different resources that you guys have created over the past 5 years in particular that are very helpful about creating walkable communities and cross-sector collaborations. And there's reports on trends in physical education, all very, very helpful tools that people like we can use at the local level. So what's on in the future for the national plan?
Well, right now we have some working groups that have been put together under the auspices of the Physical Activity Alliance, but in a national plan section of the Alliance, Robin, that's meant to really try to enhance surveillance, and not the bad kind with black helicopters, but public health surveillance of behaviors that for physical activity that might allow us to get a better idea of who's active, when they're active, where they're active, in order to then figure out the sector-based, to refine sector-based approaches and such that local planning may be more effective in targeting people or behaviors or sectors where things may or may not be at an optimal level yet. So the next few years, working with the National Academy of Medicine in partnership and the Alliance and the National Physical Activity Plan, we're seeking to really enhance our ability to get tools for local implementation, for state implementation, to get better data. One of the cornerstones of good public health is surveillance data. You got to be able to measure things if you think they're important, and we think they're important. We've got to be able to do a much better job of measuring things, this particular behavior.
Well, that is a great lead-in to what we'll be talking about next week in the Partner Spotlight, which is the launch of, or the formal release of the Kansas City Physical Activity Report Card for Children and Youth that is based entirely on local surveillance data. And just as you mentioned, the grades that we're assigning are only good as the data that's available. So we have both strengths and weaknesses in our Kansas City region for that local data. But we'll talk more about that next week. We'll be talking a lot about this on Thursday, September 10th at the first ever Kansas City Physical Activity Summit. Again, if you haven't registered yet, go to kcphysicalactivityplan.org and sign up. If you have registered, we'll see you at 8:30 a.m. On September 10th. We've got a great program, and so we hope to see you all there. Dr. Kohl, thanks for talking with us today, and thanks for your support over the past several years in our work in Kansas City. We really appreciate it.
Well, best of luck. I believe what you're doing in Kansas City is a model for other cities around the country. So thanks for your leadership.
Great. Well, thank you, and stay safe, everybody. Bye.